wish you all a very good evening. On behalf of Serono and Serum International Limited, I welcome you for this wonderful evening ahead. Before we start with the session, may I request Mr. Dugal to welcome Dr. V.S. Singhal. May I request Mr. Yogesh Sharma to present the welcome bouquet. Now may I request Pankaj to present the welcome bouquet to Dr. M.V. Padma. I once again welcome you on behalf of Serono and Serum International. Today we are looking forward for a wonderful evening where we are going to discuss something very special. Just imagine having a disease that can strike you anytime, that can blind or paralyze you, that can last for days, months or forever, gives you hopes in remission and then despair in relapse. This is a typical description of a life with multiple sclerosis. What are the impacts of multiple sclerosis? A very unfortunate part is this disease strikes strikes young people at peak of their career. 75 to 85% becomes unemployed because the employers do not want to take any risk with these people. And 80% eventually get disabled and get into wheelchair. Approximately 10,000 people in India are suffering from multiple sclerosis. It strikes at a very young age, maybe 25 to 40. It's more prevalent in white-skinned people. It is most unpredictable disease. There are many cases, maybe more than 10,000, but many cases are undiagnosed or mistaken for some other disorder. Now, few experts have concluded that the MS form, the European and the Asian form of multiple sclerosis is little different. That all we will be discussing. What do a multiple sclerosis patient expect from you? First of all, he wants a complete cure, but he knows it's impossible. In that case, he looks for at least improved quality of life so that his working life, his social life is okay. He wants some drug that will successfully prevent the relapse or successfully delay the progression. He knows even if the side effects are there with the drug, the side effects, what he expects should be tolerable. More he expects is easy access to therapy and more information and knowledge about them. Since we have passion for this type of patients, we are moving forward. We want to do something, we want to bring something good to their life, and that is how we are here to learn more. It is said that the more extensive a man's knowledge of what has been done, the greater will be his power knowing what to do. And we are here for knowing what happens in MS and how to manage MS. Today I have a privilege to introduce Dr. M.V. Padma, who is the program coordinator of this evening. Dr. M.V. Padma holds the post of additional professor. We are extremely sorry for the typo error mentioned in the invitation card. It is associate professor. Sorry for that, ma'am. She holds the post of additional professor at All India Institute of Medical Sciences, New Delhi. She has been an outstanding student of Osmania University from where she passed her MBBS in 1985. Then she did her MD and DM from All India Institute of Medical Sciences, New Delhi. She has won several gold medals in her career. She has more than 200 clinical papers to her credit. The credit of starting stroke clinic at All India Institute of Medical Sciences goes to her. She is also program director of recombinant TDA project along with organ transplantation team of All India Institute of Medical Sciences. At present, Dr. Padma is handling two major projects as principal investigator on evaluation of temporal lobe and retrospective comparative study on human gliomas brain tumor. She has put in several efforts, several projects, and she has done a lot of work, but due to time constraint, I may not be in a position to brief all those. I take pleasure in inviting Dr. M. V. Padma on this.